The trade organization that I belong to, the American Academy of Facial Plastic and Reconstructive Surgery, has a humanitarian arm called the Face-to-Face Foundation. And we knew once we saw that this conflict in Ukraine wasn't going to be over quickly, that there would be a lot of civilian casualties and facial injuries. And what we specialize in is penetrating trauma to the face, head, and neck. We're not on the front line. They get patched up acutely at facilities that are close to the action. But these are all people who are healed but have significant deformities, dysfunction. They can't chew, they can't swallow, they've lost an eye. And so we made contact with a hospital in Ivano-Frankivsk, and we established a relationship with Razum and Heal the Children Northeast, and they helped us because of their local connections get this thing started. We planned 5 days of surgery. We needed a day to get ready, unpack, and we also triaged patients. We evaluated about 38 or 40 patients, and we ended up operating in the low 30s, or 32 or something like that. We did a full gamut of just minor scar revisions all the way up to free tissue transfer, which is a very complex 10 to 12 hour operation where you take a complex piece of tissue from one part of the body and move it up into the face, head, and neck, and sew it in with a microscope to the blood vessels in the neck. We rebuilt 2 jaws doing that. We rebuilt a lot of orbits, the bone around the eye, with those titanium implants, bad scars, a lot of eyelid work. A lot of eyelids were scarred and pulled down or up away from the eyeball, and that's very dangerous if the eyelid can't close over the eyeball. So we released a lot of scars and did some skin grafts and different types of reconstructive surgery around the eyes. We're planning a team to go back at the first of the year, and then we're planning another one in the spring. If I go back, it would probably be a year from the last trip, sometime in the fall.